Korea's daily tally has hit above 100,000 on this Friday, and pundits are claiming that the tally will reach higher numbers in the near future. For more on the domestic COVID-19 situation and efforts to address it, I have Dr. Kim Seung-taek from Institute Pasteur Korea. Dr. Kim, it's a pleasure to see you again.
Good afternoon.
I also have Dr. Son Ho-jun at Johns Hopkins University, who is currently in Daegu, live on the line. Professor Son, it's great to see you again.
Hi, Sunny. Thanks for having me back.
Right. Dr. Kim, how would you describe Korea's current COVID-19 situation?
Well, to answer that question, I think we have to first look at the situation in foreign countries, including the U.S. and then the European countries. And I don't know if this is fortunate or not, but that those countries are actually experiencing the Omicron surge just beforehand, and then we actually can just learn from their situation. And actually, their situation help us to just predict what we will experience in the near future. And then those based on those situation, our situation seems to be, at least the number of just confirmed cases are still just escalating right now, and then we do not for sure when we will actually reach the peak of the infection cases. So that's the current situation that I just know so far. Yeah.
Right. And Dr. Son, the number of critical cases is also growing, albeit at a slower pace than the number of daily infections, of course. And authorities claim the medical arena can accommodate 2,000 ICU patients. What are your thoughts?
Yeah, so certainly as we see more cases and the cases are increasing at an exponential rate, we expect to see the people in a critical ill phase and people dying will increase as well. These numbers will lag about 3 to 4 weeks. So we will see how this will accumulate. But the Korean government has set up a capacity to have about 2,000 to accommodate about 2,000 critical patients, and we're still at a very low levels in terms of reaching that capacity. So I think we're in a good controlled state. But again, I think this is also attributable to having plans for a lot of people who are asymptomatic, who have lesser of the illness, taking care of themselves at home, waiting out to have the illness pass by. So we have to kind of be a little bit cautious with this approach at this stage.
Right, we do need to be cautious then. Dr. Kim, there are also conflicting calculations about Korea's Omicron peak, with some saying early March with 200,000 daily infections and others betting on mid-March with 270,000 daily cases. Where do you stand?
Well, first of all, just this kind of prediction is really difficult. Some say from this modeling and the prediction, just professionals, they even say the prediction just way beyond 2 weeks after this is really just difficult. And then there are a number of just some variables that actually just affect this sort of just the prediction. Just early in the COVID-19 pandemic, the prediction was really just a little bit just easier because every person was just very naive in terms of immune status. Nobody was actually immune to this virus. So then the prediction was sort of just very straightforward, and then just a smaller number of variables. But now we have, the virus is Omicron. There's no more just variable in this case. Just Omicron is just predominant. But there are some immune status are quite different. Just for people to people and then country to country, because now some people are actually just immune by just a natural infection, and others are just immune by vaccination. Even for vaccination, different kinds of vaccine, just platform technology, so the immune response is a little bit different. And also depending on how many shots the people just get, whether it's a primary shot series or just a booster shot series, the immune status also different. And also this prediction can be affected substantially by our social distancing measures. And then this will actually affect our human behavior. So anyway, whatever the prediction is correct. The current situation, everybody just agrees that the numbers will increase, and then whether it is just a sharp increase or just like a broad distribution, we will see in the future.
We'll just have to wait and see.
Sure,
then.
yeah.
Dr. Son, the daily tallies that Korea has been witnessing in recent days are unprecedented, and they're bound to be causing quite a bit of concern for some people here in the country. What are your words of advice to them?
Right, I would say it's unprecedented everywhere else. You see U.S., you're seeing these numbers at an unprecedented rate, but also at the same time, it's declining at a very unprecedented rate without additional lockdowns or very stringent measures. I think with this virus, right, the Omicron and the additional variant, we know from the beginning the biological properties, epidemiological properties have the right case to have these transmission occurring much at a higher rate. And we're just seeing that at the end of the day. What I want to iterate here is that, and I've iterated before, and other experts have iterated well before as well, except for the very beginning when we didn't know anything about COVID, is that, number of new cases are very important indicators to understand the overall disease burden and the burden to the health systems and the society. But what's more important is how many people of these new cases ending up in more severe disease state requiring ICU and then ultimately resulting into death. What we're seeing overall across the globe and in Korea, we'll see, is that the number of people ending up dying due to COVID is sort of stabilizing. The absolute number is increasing, but that's again is associated with the sheer number of new cases that we're seeing, and then we're also seeing that the number of hospitalizations are not significantly increasing. But again, this is also associated with how many people are actually protected and adherent to mask wearing policies. And in the US and UK, they're not, but in Korea, we're very, very good about wearing masks and being vaccinated. So in terms of new case numbers, we should be concerned, but we should not be fearful of these new numbers. It's inevitable that the virus itself is very transmissible. So we'll see more new cases in the coming weeks.
Right. And meanwhile, Dr. Kim, against the backdrop of nearly 110,000 new infections, if you're talking about this particular Friday, authorities have allowed for a slight ease in social restrictions within drinking and dining establishments, allowing them to stay open until 10 in the evening. How do you respond?
Well, I think, but personally, I thought that this is kind of just a very minimum just a change, just considering the current situation. But anyway, just the governments and then the experts, they actually just weighing just the two main factors. One is the just controlling the number of just severe cases, not the total just case numbers. And the second one is how we can just reduce the socioeconomic burden, especially for the small business owners. And they're just weighing between just the two factors. And I think just the government just actually chose this minimum just to change compared to the just current measure of the social distancing guidelines.
Right. And staying with social distancing guidelines, Dr. Son, what are your thoughts on the fate of Korea's distancing measures after Omicron?
Yeah, so I think it's very difficult to make any significant change at this time. Again, because the virulence and the transmissibility of the virus, it's beyond definitely the levels where we can control to have a zero transmission, right? We originally thought we could, but with each variant arising and an increase in transmissibility properties, it's inevitable that it's very difficult for us to control and be very restrictive. And also at the same time, there are now studies showing that with other disease as well as just socioeconomic status and issues, more stringent social distance policies, lockdowns, will likely have much more adverse events than in the consequences due to COVID transmission itself. And so it's relatable to all of the disease severity, the issues that we currently already have. And I think it's okay and it's right for the government to just see how things are going, but not lay off all of the restrictions down, because we actually don't know how this virus will behave. And just to give a UK example, where it seems like it was coming down rapidly, it's being very stagnant, right? So the government has all the rights and evidence to be cautious about adjusting social distance policies at this time.
Right. And staying with restrictions, Dr. Kim, the QR code-based registration requirement here in the country is also looking to be lifted. What are the implications of this measure?
Well, this is one of the way to just trace the contagions, just infection, just the series of infection. And this is one of the big T's out of just three. One is just a test and the trace and then treatment. And we cannot actually just rule out this kind of just one of the big T, because this is just an essential part of just the current measures. So the shift is just reflecting just some current situation. Now we are experiencing more than 100,000 new cases of infection. So now just the epidemiological investigator cannot just follow of all those the tracing issue. So then now just actually shifted to the sort of just a self-report. This is very much just as a voluntary reporting. And then maybe we actually expecting maybe people just infected by the virus now just report the voluntary, and also just let other people they actually just contacted after the exposing the virus to prepare, and then themselves maybe just the testing for just COVID-19 and things like that.
And what are your personal thoughts on that regarding the safety of such a shift in measure to allow people to voluntarily report their whereabouts and contacts?
Well, I think they need to be just the first was just well informed, because previously all the governments sort of just all just take care of all those just a very tiny just little things. But now the responsibilities are really just shifted to the people themselves. So they need to get just well informed, whether it is just any other just direct just contact phone number, or just internet or just websites, things like that.
Right. Dr. Sun, being eligible for a PCR test has reportedly become tougher here in the country, and most are recommended to receive a rapid antigen test whose accuracy has been disputed in some cases. Now, accordingly, some believe the actual number of infected individuals, including a large proportion of asymptomatic patients, may be higher than the current tally. Do you agree?
Yeah, so in terms of the move to restricting PCR test usage, of course, people definitely, if they can pay for the PCR, I think they can get PCR tests if they need it. The free PCR test that's part of the government program and part of conduct investigation, I think it's the right move, because we are seeing huge restrictions in terms of resources that we can use to find cases at this time. The sheer volume of people that needs to be investigated is just too high. So the government needs to be strategizing the best way to utilize our PCR test capacity. So this is the right move. In terms of your second question, yes, because we're restricting to those who are extremely needed to get PCR tests to be confirmed as COVID-19 cases, we're likely going to not capture all of the prevalent cases. But this is the state of affairs, the pandemic, the Omicron surge around the globe. It's going to be very difficult to find every single cases. We have to be relying on people voluntarily testing themselves, being alert and vigilant about their own health status, and then so that they're not jeopardizing their own health, but also not jeopardizing other people. But again, there are going to be a lot more unrecognized infections for sure. This is part of the process. What hopefully is fortunate thing is that the severity of the disease that we are seeing with Omicron is not as significant as we have experienced in the earlier variants. So that's what I think the decision was for the government to move towards this direction.
Right. And Dr. Kim, some regions have been recording an alarming number in breakthrough infections among the elderly at healthcare facilities. Now, the elderly that received their booster doses back in November, are these cases reflections perhaps of waning protection?
Yeah, that's true. And then this situation actually reminds me of the last November situation, that when we actually started living with COVID-19. That time actually, one of the things that we did not expect that time is, there was actually timely action, but then suddenly we actually witnessed just increasing number of infections, especially in the nursing hospital and the nursing homes. And then the reason is that the people residing in those facilities are very vulnerable to the infection. They are basically have very weak immunity. So then and also governments and even experts did not expect such kind of situation, because we did not actually understand completely about the some immunity conferred by our vaccination. But then we realized that maybe the cellular immunity is still fine, but antibody response is just waning over a period of time. So then that government now also the countries just started some booster shot program. But then even after booster shot, now the experts agree that the antibody elicited by the vaccination is just lasted just 3 or 4 months. And then even the antibody now just raised by the vaccination is not really specific for the Omicron, the spike protein. So now the specificity of the antibodies is still just lower. So then now we are just seeing just the breakthrough infections, especially in these elderly people. And so that's why the government now just recommending the sort of just a second booster shot for these the vulnerable people. And then regarding this some booster shot program, there was some very interesting the report about the where actually SOA mentioned about the some updated vaccine, and then the Moderna has actually just developed the some Omicron specific just the vaccine, and then tested those the booster shot for non-human primate. So those non-human primate, actually those the primates actually experienced already 2 shots of Moderna vaccines. Then for the booster shot, the scientists tried the 2 different booster shots. One is the vaccine with the original, the original just a vaccine, and the second one is the actually Omicron just the specific the vaccine. Well, interestingly enough, the result was almost the same. Whether we actually just administer the Omicron specific vaccine or just the original, just old vaccine, the protection efficiency seems to be very similar. So that's kind of just update.
Dr. Sun, the quarantine period for COVID-19 patients was recently shortened to 7 days from 10. But given the potential disruptions to essential services and work within the community, as many become infected, there are calls for the isolation period to be further shortened to 5 days. Very briefly speaking, are these calls practical in your view?
Yes, I think they are. And first of all, again, I think it's practical because it's just sheer volume of new patients that people can manage with very strict quarantining observation is going to have already passed. So, 5 days or 7 days, it's just going to be just numbers at this stage. I think it's shortening will definitely take a lot of burden off from businesses and people themselves as well. The psychological burden of being quarantined and being very restricted for 7 days is much less for 5 days, right, compared to 7. So I think ultimately we'll move into shortened quarantining. And then, but again, we will have to wait and see where I think the government is buying the time. We need to buy a bit of time to make sure that we have the strong evidence to move towards the shortening of the quarantining process so that we can adjust ourselves to a potential, unseen infections that could be transmission that we can't observe and limit those, the consequences from those.
Right. I see. All right. Professor Son, as always, thank you very much for your thoughts. Dr. Kim, here in the studio, thank you very much for your insights today.